Today we have Epic, Spok, Vyaire, and Smith Medical in the showcase to demonstrate how the interoperability of our products in multiple care areas can create a calm and healing environment for patients in the hospital. We'll showcase Tina, a 39-year-old who is admitted into the hospital after a car accident. We'll follow her care as she starts in the ICU and then goes to the step-down care area. The focus will be on creating a calm, healing environment for both the patient and caregiver by providing clinical decision support, auto-charting, and removing unnecessary audible alerts. Caregivers are frequently inundated with data to interpret, audible alarms, and charting activities that take away from the optimal patient care. Additionally, devices creating audible noises within the patient's room are not conducive to a calm, healing environment. Data and alert fatigue lead to delays in treatment and add stress to the overall patient experience. The ability to auto-chart data, receive automated clinical decision support notifications, and to silence audible alarms allows the clinician time to better prioritize patient care and workflows. And now I'm going to hand it to Chris from Vyaire for the ICU.
Thanks, Amy. So our patient Tina is admitted to the intensive care unit after surgery following a car accident where she has suffered a broken femur and a perforated abdomen. Tina is placed on a Vyaire medical Bella Vista ventilator and an ICU medical infusion pump as shown here in this environment. Tina undergoes lung protective mechanical ventilation while also receiving continuous infusion of sedation medications. The first stage in data and device interoperability when Tina is placed on the ventilator and infusion pump is to associate her to both devices. Vyaire and ICU Medical's integrated patient association mobile app is used to scan Tina's wristband along with the barcodes on both the ventilator and the infusion pump. Epic's EMR sends the ADT feed for Tina to the Vyaire ventilation server, which associates the data from both the Vyaire Bella Vista ventilator and ICU Medical's infusion pump to Tina's record. We can observe the association of Tina on the monitors behind me. On this first monitor to my right, we can see Tina's patient tile in the bottom right corner, showing both her ventilation and infusion data. On the second monitor on my left, we can see Tina's individual patient screen in the Vyaire Messenger mobile app, which is in the hands of respiratory therapists, physicians, and nurses on the floor. As Tina is ventilated during this critical time in her care, her respiratory therapist must regularly chart her ventilation data. Vyaire's connectivity with the Epic EMR through HL7 enables this data to be automatically charted, freeing up the clinician's time to assess and provide direct care for Tina. Data is sent from the ventilator to the EMR at regular intervals. If we look at the Epic monitor down to my right where Dan is sitting, we can see in the Epic Hyperspace flow sheet, Vyaire ventilator data is being updated every 5 minutes. A clinician using Epic's interface will then review and validate these charted parameters as demonstrated. Thanks, Dan. The clinicians that are taking care of Tina are also caring for other critical patients. During the early course of her ventilation, changes are made to Tina's ventilation settings, and her PEEP and sedation levels are both increased as she worsens. The RT and nurse caring for Tina receive silent notifications on their mobile devices of these events, and they can immediately view Tina's complete ventilation data and infusion information either on a workstation on wheels or in their mobile devices. As we can see on this first monitor on my right, Tina's patient screen in Vyaire's respiratory knowledge portal is showing the increases in both her PEEP and her infusion sedation drugs. On the second monitor in the Vyaire Messenger mobile app, we see the messages which were sent to the clinician phones and mobile devices related to her pump sedation levels being increased, as well as her PEEP settings increase. Tina improves over the next 48 hours, and while her clinicians are busy with patient care, a weaning candidate notification is generated by Vyaire's respiratory knowledge portal and sent to the clinician mobile devices. The interoperability of Vyaire's ventilation server and ICU Medical's infusion platform enables the analytics that determine Tina is ready for a spontaneous breathing trial and prompt her care team to take action. As we can see on the first monitor on my right in Vyaire's RKP, Tina's sedation levels have now been reduced for her sedation awakening trial and her spontaneous breathing trial. On the other monitor on my left, we can see the weaning candidate notification that I mentioned a few minutes ago that was sent to Tina's care team to prompt and coordinate her weaning workflow. Tina's weaning trials are successful, and she is ultimately extubated and moved to recover in the med-surg unit. During the course of Tina's care in the ICU, interoperability between Vyaire Medical, ICU Medical, and Epic created an ideal and calm environment for both Tina's healing and her caregivers' workflows. By providing seamless patient-device data association, auto-charting to the EMR, remote data viewing, and silent clinical decision support notifications, her clinical team was able to effectively and calmly coordinate her care. We're now going to follow Tina as she recovers and moves into the med-surg unit, so I will pass it over to Smith's Medical. Thanks.
Thanks, Chris. Tina's condition improves and she is transferred to med-surg. Tina is placed on an IV PCA pump for pain management during her physical therapy sessions. She has just returned to her room after a particularly difficult therapy session and is currently napping. As with many patients, Tina has several alarms occur during the day at the bedside. This includes alarms from the nurse call system she interfaces with and any patient care devices she's connected to. Only some of these alarms require immediate action by the caregiver. In this case, the drug reservoir is nearing empty, triggering the near empty alarm on the pain pump. The Smiths Medical Pump Gateway silently forwards this type of alarm using the IHE ACM profile to the alarm manager, Spok. Tina's nurse receives the alarm at the nurse's station and can acknowledge it without waking the patient. She then orders the next dose from the pharmacy so that she will be able to replace the drug reservoir with one visit into the patient's room. If not acknowledged within 2 minutes, an audible alarm will sound in the room. I'm going to turn it over to Rob from Spok.
I'm Rob Lowther with Spok. We are the alert manager actor in this use case, and we are part of the IHE ACM profile. So immediately after the alarm condition starts, Spok is going to receive an IHE standard formatted message from the infusion pump. The alert manager from Spok is going to analyze that content that we receive and determine immediately the source of the event, the type of event we're getting, patient information along with their location, and alert details that are going to help with the triage of this event. Once the alert manager confirms the alarm state and the priority of this content, notifications are immediately processed to the appropriate locations. Now, these locations can include dashboards for alert triage or tracking, with simultaneously delivering that information to caregivers responsible for the patient. In our use case, Tina's nurse is going to receive this notification on her Epic Hyperspace dashboard that she's logged into, and we can see that on the monitor over here. And if she's not logged into her dashboard, we can alternatively send that information to her mobile device, so we make sure we get it to the right device that she's on currently. Now, if our nurse is mobile, and most often they're going to be caring for another patient, some things can be done with the alert to help triage tasks and ensure efficiency. Since the nurse doesn't carry the phone around in their hand and it's most likely in their pocket, we can provide a unique alert tone on a per event basis that allows the nurse to know the type of event, the specific event that they're getting from the sound in their pocket. This allows them to know the priority and the specific type of event they're getting. So if the nurse is with another patient and a lower priority event comes in, the nurse will now have the time to answer and not interrupt the process with their current patient to answer that event, because she knows that's a lower priority. And reminders can be sent at specific time intervals to make sure that she does address that event in the proper amount of time. So in this case, since the alert is for an end of infusion, Tina's nurse is going to know how much time she has to address that alert at the pump before the infusion ends, or audible tones are going to be triggered in the room via that timer on the device. When the nurse can answer, she's going to pull out the phone and address it. She's going to get a color-coded message that is presented to her on the device with specific information about the alert to allow quick decisions in the clinical environment. This information can include patient information, the vitals of the patient when necessary, the assigned location, the alert type, and the priority of that message. Along with this information are options to allow for acceptance of the message, to take responsibility for it, or alternatively, if the nurse doesn't have time to take care of this task, forwarding or escalating it to another caregiver on the team with a simple press of one button. In this case, Tina's nurse is going to accept and address this alert. But if she didn't, then an alert-specific escalation will automatically occur to ensure Tina's needs are addressed based on timers, along with an audible notification from the infusion pump for the area that's going to let everybody know in the area that the event is taking place. So we want to talk briefly about the alert profiles that are enabling this, but first I'll go through some benefits. And there's benefits for both Tina and her caregiver. So for Tina, while the alert notification is sent out immediately to address her needs by the right person and on the right device, the patient room is going to remain quiet. So no audible alert tone is going to occur on Tina's pump in the room that would disturb her rest and recovery. This can have an eventual effect on well-being, overall experience, and potentially the resulting HCAP scores for Tina when she leaves the facility healthy. This technology also has benefits for Tina's nurse beyond her patient satisfaction, which naturally she cares about. Thanks to the additional time the nurse is given to address this infusion alert, she can prioritize more critical needs with other patients while still ensuring that the task of addressing the alert for Tina is handled in a timely manner. This is going to help to ensure patient needs are addressed on the unit with safety and efficiency without unnecessary escalations or added alert fatigue for Tina's care team. This med-surg use case is all driven by IHE standards-based profiles that are available in the market today and deployed by a large number of vendors. These standards are being used also in a multi-vendor initiative called the Quiet Hospital at the IHE, which has a goal to increase patient satisfaction, to increase nursing efficiency, while maintaining patient safety and reducing alert fatigue for the staff. So I'll turn it over to Kurt here on the monitor to your left to look over the standards and the typical types of transactions we use when enabling these profiles. Kurt.
Hello, I'm Kurt from HIMSS Medical. The demonstration here primarily uses the Alert Communication Management, or ACM, profile with IHE. There are 4 primary transactions or message types involved. The HIMSS Medical, acting as a alert reporter, sends a PCD04 transaction type to Spok, who's acting as the alert manager, who then sends a PCD06 transaction to Epic, acting as the alert communicator. When the nurse responds to the alert, either accepting or rejecting it, Epic sends back a PCD07 to Spok, who routes that as a PCD05 to the HIMSS Medical server, and the pump can either silence an active alarm or enable the audible if the nurse had rejected it or if there's a timeout. That concludes our presentation.